Hello and welcome to Dukascopy TV. Today we're exploring investment opportunities on the continent of Africa, but specifically we're looking at the link between health and the economy. Well, in the studio today I'm joined by Guillaume Taylor and Cheryl Hicks from Quadia, a wealth management company specialising in impact investing. Welcome to the studio.
Thank you.
Good morning.
Now, we're talking Africa today. I understand you've recently been to the continent, you visited the continent. Kenya, I understand. Why have you chosen Africa, and why specifically Kenya?
Africa is a really interesting area for impact investing. What we've seen is a couple of areas. We've seen the success of microfinance in Africa, of course, which is the beginnings of impact investing. We've also seen many people are aware of the rising interest in consumer goods and the rising consumer class in Africa. But in between those two areas, there's a lot of companies that need to support that growth, and that's what we're interested in impact investing. And we're finding that a lot of those companies are addressing basic needs and areas of sustainable economic development. So areas we've talked about before on this show of environment and social issues. So small and medium-sized companies that are starting to grow up into supplying larger corporations and the rising consumer class in Africa. So we're seeing a lot of very interesting investment opportunities in Africa.
Guillaume, obviously, presumably, as a result, you've brokered some deals. You've been talking to various people on the ground there. Can you just give me an indication of what sort of investments you were looking at while you were out there?
Yeah, we came back from our trip with a lot of deals, and very interesting deals, and we visited a lot of companies. Energy access is obviously right now the driving investment opportunities. The grid is not going to be developed in Africa, so there are a lot of off-grid solutions, solar panels, mostly solar panels, some biomass. Wind is a little bit early right now for Africa. We saw a lot of opportunities in mobile technology, and that's the most exciting area that we've seen. Financial services through mobile phones, access to health data. We visited a very interesting company that's focusing on data processing for really basic companies dealing with sanitation, water, also biomass. So technology is coming into these areas. We looked at obviously health services, and that varies, but there's a lot of innovation going on. So we're trying not to replicate the traditional health systems in Europe. We're trying to find new innovative ways of getting that health outreach in Africa.
Health, I think, is an interesting area as well in terms of Africa, where investments sort of here in Europe, and investors, tend to be looking at those as something sort of the public sector has been taking care of and struggle to find where their investments can play a particular role. Impact investments can play a particular role in health, but in Africa it's very clear. It's very clear and demonstrated that private investments in health are much more efficient than public investments, and this is coming from a lot of the international organizations who are very much supporting private investment in health.
I mean, you say it's more efficient. I mean, but what interests me is quite obvious that perhaps if you're linking health to a better economy, obviously people in a particular country or on a continent such as Africa, if they have improved health, improved living standards, it's going to benefit the economy. Isn't that a bit obvious, though?
Yes, but what we're trying to do here, and some of the collaboration that maybe Cheryl will mention later, is most of the money has flowed into private capital and development money has flowed into the health system, specifically for that link. You develop the health system, you improve the economic development. But why not look at things the other way around? Why not improve economic development, and then it will have a more sustainable consequence, viable consequence on the health system. So what we're trying to do is really target economic development, focusing on that, and that how it will have an incidence on the health systems, and not the other way around.
Okay, and what's the sort of cost of this? I mean, this would obviously Quadia moving into Africa. What sort of costs are we looking at here? Are there I mean, presumably there will be some returns from this venture.
There will be returns, and so the costs the transaction costs are enormous. So we have to look at partnerships and collaborative investing. So part of our trip was also to look at co-investment opportunities with firms that are established in Africa. But also the collaboration that we're looking at is working with different specialists in health, in capacity building. And we're right now structuring a capacity building technical assistance facility that will be able to help the companies grow once we've invested in them, making loans or taking an equity position.
This has been one of the particular, sort of interesting points of discussion with investors is around the growth opportunities in these companies. And while we see a lot of interesting numbers and interesting prospects for growth, especially with the consumer class, what they call is the missing middle. And so we see a lot of very interesting companies emerging, but they still struggle with the management skills to grow to the level where we can have significant impact on the one hand and returns on the other. And so what Guillaume is talking about, the capacity building facilities that are being set up in partnership with NGOs who understand some of the issues and drivers of why there's a missing middle. We're finding this very interesting, and investors are finding this very interesting as well. So I think we're going to see this as a trend in the future, that investments in Africa will be tied to these capacity building facilities that can really help the companies with some basic management and skills in order to grow.
Yeah.
Okay,
and sharing the costs.
Okay, just finally, sorry, very quickly, you mentioned trends there. Is this a long-term investment? Is it going to be one of these, walk in whilst everything is sort of hot, walk out, find someone else? Is this going to be a long term?
I mean, for us, impact investing is a long-term patient capital investing, and for us, as Guillaume said, we're looking at strengthening of systems, whether it's through economic development. So supporting the small and medium-sized companies will strengthen the economic systems and will have an impact on health. Will have an impact on a lot of the other social issues. And coming at it from an impact investing perspective, we can also safeguard the environmental issues as well. So strengthening of the economic system is really the driver of our investments in Africa.
So it's going to be very much Quadia in Africa, doing everything for all of Africa.
Exactly. And the next interview will be in Africa with Dukascopy.
I see. We'll see about that. Thank you both very much for coming into the studio
Thank
today.
you,
Thank
Thomas.
you.
That's all we've got time for today on Dukascopy TV. Of course, we'll continue to bring you exclusive interviews and updates, so do stay tuned. But for now, goodbye.